I'm going to go over some basic restraints that are important to know if you are doing first aid with a dog. For the first 3 restraints, one thing that's going to be in common is how you're going to control the head to protect someone that needs to do any sort of treatment from the head down on the dog. So what you're going to do with your arm is you're going to take this elbow, your elbow and the inside of your elbow, and you're going to move it in all the way to the neck of the dog, and you're going to keep your elbow underneath the chin of the dog. So if you watch this, the dog cannot dip its head down to bite my own arm. I have my hand crossed over the dog's withers over here, and I have pretty good control over the head where there is a barrier that will protect anyone who's doing anything on the front legs of the dog. This is called a standing restraint because I have this arm underneath the belly all the way up against the dog's legs. This prevents the dog from sitting, which is necessary if someone has to do things like take temperatures and look at the rear end. The next restraint that you would want to know how to do is a sitting restraint. So from here, you don't do anything else with your front arm. You simply just take out this arm that's underneath the belly, and you go around the rump. She's doing it, and you scoop her underneath, all right? If she lies down and you need her sitting, of course you can go like this. You can get an arm after you scoop underneath her belly, and my hand is on her chest, and I'm keeping her head up. So this is called a sitting restraint. The next restraint is called the sternal recumbency, right? The sternum, which is on the chest, right over here. We want that on the table. And in order to get in this position, you can either have someone help you pull out the front legs, or you can just take your arm and scoop out the front legs yourself and come over with the dog like this. Generally what you want is you have this arm across the dog's body. You maintain your other arm like this, and this is a common restraint to do if someone's working on the front legs of the dog. So I have this hand here that could push out the elbow if they're doing something like doing blood work, clipping nails, doing any kind of procedure on the front legs. The next restraint is called the lateral recumbency. The lateral recumbency, that's lateral is the side, recumbency is the side down, is a very good restraint to have access to the whole bottom part of the dog, the paws. You could do lots of things over here. Right now, her legs are facing toward me, which makes it difficult for me to do the lateral recumbency if I want the dog facing that way. So what I'm going to do is I'm going to stand her back up into a standing restraint. I'm going to scoop her back down into a sitting restraint. And now I'm going to come over and grab her back leg that's closer to me above the hock joint. All right, above the hock joint. You'll see it better when I move her into position. And then I take this arm that's around her head, and I'm going to come around the front of it and grab her forearm. All right, now watch where my hands are. I have one hand where the hock is, one hand on the forearm, and then my forearms go down. This forearm is in front. She's pretty hairy, you can't see, right in front of her shoulder and in back of her head. This hand is right into this groove of her leg. My forearms are down and her back is against my body. From this position, if she was to struggle like she is now, you can easily put your forearms down, keep her against your body like this. If you have a dog that's very scared or you think is going to be aggressive, you definitely want to put a muzzle on the dog with this restraint, because you will be more vulnerable in this position. So this is how we would do the lateral recumbency. With all restraints, it is definitely best to use the least amount of squeezing and keeping the dog in the position, because that would make them panic. Have yourself in a good position where if they do struggle, you just sort of tighten up, and as they stop struggling, loosen up a bit. Although I'm talking to you on the camera, whoever's doing the restraining should also be talking to the dog. It does make a big difference that they know you're not trying to harm them when you're talking to them calmly. Next, I'm going to show you actually how to do this on the floor, at least the lateral recumbency, because this is one that you may have to do in an emergency. To get her back up, I'm going to scoop her back up, right, into a sitting, a standing. I'm going to come, I got her on a leash to keep her safe so she doesn't go jumping off the table. Actually, I'll pick her up from here. All right, if you have a leash on the dog, by the way, it is always good when you're doing these things, even when I'm lifting her, I keep a very short control over the leash, just so I have better control over the dog. To put the dog onto the floor, I'm going to go around the front and the back, carry her. Darcy's not a very big dog, she's maybe like 45 pounds. Always bend at the knees. Now suppose we need to do a procedure with her on the floor. The lateral recumbency is one of the best restraints that there is. Now from here, notice I always like to keep a short leash, just in case if you misjudge the dog turns around, tries to bite you in the face or something. The short leash could save you very, very quickly. I'll also maintain this short leash while I get into the position. Now watch how I do this. I'm going to take my hand here and I maintain control over the leash just in case. Come over her neck to her forearm. This goes over above her hock and I'm going to lift and slide her down my legs gently onto the floor. I have her withers and her loin on her back or against my knees, and I have my forearms over in front of her shoulder, right in front of her hip over here. Now this is a good position again, especially for an emergency. Use a muzzle if you need to. Darcy's being a very good girl. It's usually not that easy, but at least you can see where the position is. Okay, so this is a lateral recumbency. As you can see, we could look at all the paws. We could get underneath the belly. We could do a lot of things over here. Okay, and to get the dog back up, of course, always keep control over that dog, no matter what. Darcy, come on. Good girl. All right. Actually, one last thing, because I did do a video on a leash muzzle. All right. Again, the leash muzzle for an emergency situation can come in handy for all these things, even with the restraint. Just there's a whole video on it, but to show you quickly, opposite hand behind the collar over here. I like to have the leash. The leash starts back where my hand is over here. I'm coming underneath the dog. Watch this. I do 3 passes underneath, close to her stop right here. Watch this. 1, 2, 3, and then I go back into my hand over here, and I have control over her head. Now, you could do everything that we were just doing, especially with help, while you control the leash over here. So that's the leash muzzle over there. All right, good girl. Any questions? Send me a message.